Hello, my name is Jaspreet. I'm a nursing student from Seneca College in Nursing Leadership and Management. Today, I'm going to discuss the learning objectives of week 2, 3, and 4 of course Nursing Informatics. In week 2, I learn about nursing informatics and health informatics. Nursing informatics involves both the use of information and communication technologies, allowing the access and use of information to support evidence informed practice. It is an interrelated activity involving people, technologies, and processes. This interconnected triad allows trusted data to be applied in the manner that is relevant, useful, and meaningful. So, what is the basic definition of nursing informatics? According to American Nursing Association, nursing informatics defined as a specialty that integrates nurses science with multiple information and analytical science and to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice, whereas health informatics is a broad term. It is an interdisciplinary field that combines information science, healthcare, computer science, and cognitive science to manage healthcare data and information. The purpose of week 2 was identify with nursing informatics and health informatics and explains how these help a nurse in clinical practice today and in future to meet patient needs by maintaining patient records accurately and precisely. For example, it includes past medical health, past medical history, allergies, and so on, drug information, and diagnosis. EHR, that is electronic health records, that helps in introducing nursing errors and also reducing workload for nursing by saving time, as these are the electronic records means we don't have to write the patient records manually nowadays, and so we can record the patient history and other details electronically that minimize errors and also saves time. Nurses leaders use these techniques these in effective communication with other healthcare providers such as nurses, physicians, and pharmacists. For example, the EHR, that is electronic health record, give the brief report about the drug interactions, present allergies, and past medical history of every patient. So overall, nursing informatics is a tool that helps today's nurses to save time and to improve the patient care and providing the safe care to the patient, and helps in provide miscommunication between the healthcare providers. In week 3, uh, I learned about nursing informatics in Canada and different organizations in Canada, that is CNA and CASN. The CNA is the Canadian Nursing Association that facilitates communication all over the Canada. CASN is the Canadian Association of Schools of Nursing. It is the national voice of nursing education, research, and scholarship, and represent by accurate and graduate nursing programs in Canada. The purpose of week 3 was to inform the nursing students how to practice in Canada with proper rules and regulations according to CNA and CASN. The Canadian Nursing Association CNI exists in help nurses across Canada to learn, share research, and create informatics related projects and experiences that can help to boost the competencies, theory, and practice of informatics on a national level. The goals of Canadian Nursing Informatics Associations are to provide nursing leadership for the development of nursing health informatics in Canada, to establish national networking opportunities for nursing informatics, to expand awareness of nursing informatics to all nurses and the healthcare community, to facilitate informatic educational opportunities for all nurses in Canada. The objectives of week 3 are how to teach the student nurses of how to become a registered nurse in Canada, and how to do entry of practice according to the guidelines of CNA and CASN. In week 4, I learned about how the knowledge of computer is important for nurses. Computer is an electronic device which help to process and store information. I learned about the hardware components of computer, that is input, storage and output, and CPU, which is a central part of the computer. CPU is a central processing unit, which is actually the brain of the computer, which process information and give an output. And also, I learned about computer network hardware. Computer network hardware is a network comprised of two or more computers that are interconnected either by cables or Wi Fi, with the purpose of transmitting, exchanging, and sharing data and resources. Computer networks are built by using hardware and software. In nursing, computer knowledge is must so that the nurses can access the quick information about the patients in the computer, and also computer avoids miscommunication among the healthcare providers. It gives the nurse to see the proper details of the patient regarding the drug information, past medical history, and present allergies and diagnosis. Nurses use computers to record healthcare stories of patients on health records, the ongoing records, monitoring patient response and progress toward the healthcare goal. Furthermore, they use computers to obtain information about past medical history, ongoing treatment, drug information of a patient.